As someone who works on a day-to-day basis with patients, could you explain to us how this smoldering processes manifest in patients?
So the interesting thing is when you ask patients if they have noticed worsening of their neurological symptoms without having had a relapse in kind of the near time vicinity of it, most patients will, really say yes. They'll say, and so, just smoldering disease, I think, is a concept that scientifically we as clinicians and researchers are recognizing, but it's also a concept that when you talk to patients about it, it really resonates with them because this is what they live with on a day-to-day basis. And so, when you ask patients, it really depends on what symptoms people have, but many people will tell me that they just notice that their physical endurance is not as good as it used to be. And we need to keep in mind that, smoldering processes, as the term implies, it's like this slow burning ember that very slowly progresses over time. So how do patients present? Well, when you ask them, they'll say things like, I used to be able to hike easily for 15 kilometers without resting. Now I can't hike for more than 5 without resting. And then some patients will tell me, I just feel like my thinking is more foggy. And I feel like I'm often making more mistakes at work. And then when I probe a little bit further, they'll tell me about, say, issues with meeting deadlines and performance issues and things like that. So these are the symptoms that people talk about. And in an individual patient, it can be, more problems with walking or more weakness, or it can be more numbness or spasticity. The list goes on. In some patients, it can be more clumsiness or incoordination or more issues with cognition. But it varies, but I think the commonality is that, number one, the tools that we use in clinical practice are not adequate to often detect this or monitor it. And number two, it really varies, but when you ask patients the right questions, they will tell you that over the span of usually a few years, these are the things that they notice the most.
I agree with the fact that through our interaction with patients, we're really understanding even more and more and more how this biological processes manifest in their day-to-day. And if we really give the opportunity of the patient and have that conversation about their day-to-day activities, that's probably a good way of starting to understand how this looks like in the real world for them.